Hello, my name is Leanne Holmes. I'm a nurse practitioner student with Maryville University, St. Louis, and this is my head-to-toe physical exam video. This is Tristan. He has graciously agreed to be my patient for this, and I want to thank him for that. To bring you up to speed, when Tristan first arrived, he was dressed appropriately for the season. He was walking without assistance, and he was very conversational, and his mood and affect was normal. I asked him to use the restroom and to don this wonderful gown, and then prior to entering the room, I washed my hands and we proceeded to obtain his vital signs, which include his height and weight. We checked his vision with the Rosenbaum screening guide and found that he has perfect vision 20/20. So, we're ready to start our assessment. Are you ready, Tristan? Okay. First off, we're going to check out Tristan's head, and I note that his head is normocephalic. His ears and eyes are symmetrical and aligned. He has a little bit of facial hair. He has a couple of blemishes, which is still a normal finding, and a head full of thick hair that's fine texture. Scalp is movable. Okay. Close your eyes for me. I'm going to check your sense of touch, of light touch, so as soon as you feel this, let me know.
Feel it. Feel it. Feel it. Feel it.
Okay. Going to also palpate your sinuses, just looking for any tender areas. So I would feel up here and here. We're going to check your submandibular joint here. I want you to open your mouth and close it. Okay, close it. Okay. No popping, no pain. Okay, very good. All right. I want to take you through a few facial expressions. We're checking the facial cranial nerves. First one being squint your eyes, tight, really close tight. Okay, open them. We'll go over your eyebrows. Okay, and now wrinkle your forehead. Okay, smile for me. Clench your teeth. Okay, puff out your cheeks. And stick your tongue out and move it from side to side. Okay. All right, very good. No problems there. That's all intact. Now we're going to check his eyes. And so, normally, well, first off, let's talk about his eyes. Eyebrows are appropriately placed. Close your eyes for a second. I'm palpating around the eye, and there's no swelling. Lacrimal apparatus, your tear ducts, are normal. Sclera is white, and conjunctiva is pink and moist. His eyelashes are curling outward. Everything appears to be normal. Now, checking his pupillary response, normally I would do that in a darkened room, but due to lack of, I guess, stagehand help, we're going to just verbalize that we have dimmed the room. And what we're looking for is I shine my pen light into his left eye, his right eye would also constrict, and that, or pupil would also constrict, and that's called the consensual response. So I expect to see that still, even though the room is not dim, just not on as grand of a level. Okay, so just look at me. Okay, this one. Okay, very good. And that did happen. The alternate eye, the pupil also constricted with the eye that was having the light introduced. Okay, we're going to check your peripheral field now. So, yes, put your hand over there. I'm going to put my hand over this side. This is my pen light. When it comes into your line of view, let me know, okay? Okay? All right, that's fine. Let's do this eye.
I see it.
Okay, very good, very good. We're going to check your 6 cardinal fields of gaze, and so just follow my light with your eyes, not your head. Very good. Okay, moving on, we're going to now Look at his ears. I've already said that they're symmetrical and aligned. I'm going to feel the auricles, and nothing suspicious here. Warm and pink, no lesions behind. Let's go ahead and take a peek inside. Clear canal. TM is gray, but still transparent. And same finding on this side. Very little cerumen on the side of the canal there, but it does not impede the visual of the TM, which was gray and still transparent. Okay, we're going to do a couple of hearing tests now, Tristan. I'm going to stand behind you and I'm going to ask you to plug an ear, and then I'm going to whisper a word and I need you to tell me what that word is, okay? So go ahead and plug that ear.
Dog.
Very good.
Cat.
Very good. We're going to, excuse me, we're going to use my tuning fork to check for bone conduction and air conduction. So what I'm going to do is I'm going to strike this, the prongs, get them vibrating, then I'm going to stick it here on the top of your head. And what I need you to tell me is, do you hear the sound equally loud in both ears, or is it louder in one ear versus the other, okay? So I'm going to stand on this side. I keep getting on the wrong side.
Equal.
Okay, still? Okay, very good. Okay, and that's what we expect to find. Okay, this next, that was the Weber test. This next test is the Rene test, and it is bone conduction versus air conduction. And so I'm going to strike it. I'm going to put it up against your mastoid bone here. And then when you no longer hear it, let me know. I'm going to move it out, and you continue to listen through the air, okay? What we expect to find is a 2-to-1 ratio with the vibration being conducted through the air twice as long as through the bone. So, that wasn't very good.
Can't hear it. Can't hear it.
Okay, and that was definitely greater than a 2-to-1 ratio, so that was good.
Can't hear it. Can't hear it.
Okay, and that one was good too, greater than 2-to-1 ratio, so that's good. Okay, moving on, going to the nose. So his nose is midline, perfectly centered, no nostril flaring when he breathes. Let's check your patency. Can you occlude one nostril and breathe? Okay, do the other. Very good, okay. Okay, tilt your back just a little. Okay, and his septum is midline, no redness, hair is found, normal amounts, and turbinate is also visible. Okay, same on that side too. No evidence of any polyps or anything. Okay, now his mouth, his lips are pink and moist. When he was doing the expressions earlier, when he smiled, there was no difference in the sides, no drooping or anything. So that's good. So I'm going to have you just open your mouth, and I'm just going to look around. His anterior and posterior pillars are visible. Tonsils are normal size, no hypertrophy there, no redness in the posterior pharynx, and again, soft palate and hard palate are within normal limits, and his gums look healthy, his teeth look healthy. Go ahead and lift your tongue up to the roof of your mouth. I want to look. Pull down. I can't see. Okay. Okay. Floor of mouth is normal. No lesions or anything noted, and no halitosis. Okay. We're moving down to the neck now, and I feel. Skin is pink and warm, and it looks symmetrical. I need to check your gag reflex. First, I need you to stick your tongue out and say ah. Okay, that's good. Uvula lifted, which is normal. And, oh, very good. That is grossly intact. Okay. Back to the neck. Gonna check your carotid. Okay. Okay, and your trachea, tilt your head up just a little, okay. Trachea feels midline. Just looking at him, I don't see any jugular vein distension. Let me check your thyroid. Go ahead. Go ahead and swallow. Okay. Okay, that all feels normal. Let's go ahead and check your lymph nodes. We'll start with the post-auricle, pre-auricle, tonsillar, submandibular, submental. I'm going to go to the cervical posterior, anterior cervical, and the supraclavicular. And nothing is out of the ordinary there. There was no tenderness anywhere where I was touching. Since I like to do all my lymph nodes together, I would go ahead and check the axillary lymph nodes at this time. He's very ticklish, so. Okay, yeah, that's the best we can do. Okay. All right, so now I'm off track. Still going down, let's look at the back. Oh no, I've got to listen to your carotids. Okay, can you take a deep breath and hold it? Okay, breathe. Okay, deep breath and hold it. Okay, breathe. And listen over the thyroid too. Tilt your head just a little. Okay, deep breath and hold it. Okay, very good. Okay, you can breathe. Okay. Now on to the back. Lean forward just a little bit. Sitting here, his spine looks fine. It is midline. He has a keloid over here. Take a few breaths, just in and out. Just sit there normal. Okay. Everything is symmetrical, moving normal. I'm going to put my cold hands right here, and I'm going to measure your thoracic, your lower thoracic. So go ahead and take a big deep breath. Okay. All right. That seems symmetrical as well. My hands moved together when he did that. Now, I'm going to listen. Take a big deep breath. Okay. No, don't let it out. Okay. Again. Okay. Again. Okay. Again. Okay. Again. I want you to do is scoot forward in the chair just a little and kind of, yeah, there we go. What I'm going to check now is his costovertebral angle, and so I'm going to thump on you. Oh, sleepy. I'm going to thump on you just a little bit. So I need you to tell me if this hurts.
No.
Okay.
Mm-mm.
Okay, very good. Okay, and you can, well, no, actually stay there. I'm going to go ahead and do a little percussion down your back. I'm going to check for the diaphragmatic excursion, for the difference between inhalation and exhalation, which we expect to be between 3 and 5 centimeters. So what I'm going to have you do, and I would do this on both sides, I'm only going to do it on one to save time, but what I'm going to have you do is take a deep breath and hold it here in a minute as I percuss down your back, okay? Let me get my sticky notes ready right here. Okay. All right, big deep breath and hold it. Okay, you can breathe. Mark that. And now I'm going to have you take a breath, let it out, and hold the exhalation, okay? So go ahead and lean forward just a little bit more. Okay, go ahead and do that. Okay, breathe. And let me measure that. It's 4.5 centimeters, which is normal. Okay, go ahead and sit back. Okay, now we're going to the anterior chest. And so just take a few breaths. I want to see how everything moves. Okay, everything seems symmetrical there as well. Okay, I'm going to note the distribution of hair on his chest, one little blemish, and I already palpated your expansion in the back. Everything looks good here. One thing I didn't do, I'm going to check for tactile fremitus, which is just a vibration when you speak. Okay, so every time my hands touch you, I want you to say 99. Okay?
99.
Okay.
99.
And again.
99.
Okay. Mild vibration felt up here at the top, and it decreased as we went down. So let's do that in the front too.
99. 99. 99.
Okay, and same there. Most felt in the top. Okay, and so I feel no masses. Percussion is normal. I'm going to try to palpate your maximal impulse, and there it is. Okay. Now I'm going to listen to your heart. Over the aortic. Pulmonic. Erb's point. Tricuspid. And mitral. And a normal S1, S2 was auscultated without murmur. I also, when I'm visually inspecting, I don't notice any heaves, lifts, or pulsations. So that's all very good. Now, if I could get you to move over to the recliner.